Hi everybody, this is Dave from reddeercitytv.ca, and I'm at Classic Tattoo in sunny Red Deer, Alberta here with Lucas, the owner of Classic Tattoo, and he is putting on an event for the Stollery Children's Hospital, and I'll just let him roll and just tell us about what's going on. Lucas.
Yeah, it's the Hudson Heart Project. It's we're coming into the second year for it. Going to make it an annual event. And
June 14th of this year, Sunday at 9 a.m. we're going to be having a fundraiser with tattoos. So people are going to come down. We have about 20 guest artists coming from all over Western Canada. Some of the best artists all over Western Canada, which is such a treat. They're going to be posting flash on the walls, pre-drawn flash for everybody to pick from, and then it will be from $50 and up. It'll be typical walk-in style, so first come, first serve, so get here early. Usually on our walk-in Saturdays, we have people lining up at 8:30, but we open at 9, so I would suggest coming down even a little bit earlier. Last year we did 112 tattoos and raised $26,000. With all of our tattoos and with a silent auction and donations. This year we're not going to do the silent auction. It's just going to be tattoos and donation, but it'll be lots of fun. Yeah.
Now, how did you hear about the Stollery?
we didn't know anything about the Stollery until it came to the point where we actually were parents of a child that was going to be going there, going to be visiting the Stollery. So I didn't really know too much about it other than just knowing that there was a university hospital in Edmonton, which is what the Stollery is part of.
Yeah. And I just learned facts today that they see in excess of 200,000 patients a year. You know, they go through $21 million last year. I think $21 million was raised through various private donations, and I found out that they don't get any money from the government.
Yeah.
So
an amazing amount of money gets raised for them privately.
Yeah. So I mean, people like yourself that are going through this, and you're giving back, you know, and raising money. What, you know, do you have support? Do you have? Do you have lots of people that come in and they just bombard you with, yeah, we want to help you out? And
absolutely, we actually probably have more support than we can take when it comes to putting on events like this. So many people want to donate time, donate products that they can, you know, silent auction or whatever the case may be. Usually more than we can take. But I mean, even when we do the events and we have all of the people that come and get tattooed and donate that way, we still have people that donate outside of that may not be able to make it down or may not want to get a tattoo, but they still want to take part in donations. So
yeah, exactly.
Yeah.
So, I mean, you don't have to have a tattoo to do this. You can just participate in some other fashion.
absolutely.
Now, the reason for you doing all this.
Mm-hmm.
Yes. Can you explain the situation from start to finish, or I guess just explain why.
So our second son, Hudson, when we found out that we were expecting with him, we were super excited. And then we went for our regular routine 20-week ultrasound, and they said that it was hard to see the left side of his heart, and so they sent us to another ultrasound clinic. We went to Camas, and they said that it looked like the left side of the heart was growing not as much as the right side. So we were sent to Calgary, and we did some more ultrasounds down there, and it found out he had a condition called hypoplastic left heart syndrome.
So essentially, it's basically you're born with half a heart. You have a severely underdeveloped side of the heart that, upon birth, won't apex properly and function properly.
So at 37 weeks, we moved to Edmonton, and Hudson was born at the Royal Alec at 38 weeks, 5 days, and then he was sent right over to the Stollery. He had his first open heart surgery at 14 days old, and then his second subsequent surgery at 4.5 months, and right now we're just waiting for him to do his third surgery, which will probably be around 5-6 years old. Yeah.
After the surgery now, then is his heart in normal function, or is he limited because of what's happened?
So he's got a completely different heart than the rest of us after this is all said and done. He's basically got what is just a pump that kind of keeps up your low pressure system in your body, as opposed to us that we have a pump that draws blood in and then one that pushes blood out. His is just pumping. It's just keeping that low pressure up. So along with the lungs, it keeps the blood moving through the body.
Okay.
Yeah.
So it's sort of a little different.
Surprisingly, most of these kids have a lower oxygen saturation than any of us do on a daily basis. His is normally around 70 to 80 in that neighborhood. Right. We operate at 100%. Most of them, they can get by on that too. So you don't need, they have a way different cardiovascular system when they're done with these surgeries, but they are still able to function normally. He's not gonna be running against Kenyans in the, in the Olympics, but he'll be able to.
Every day he'll live his life and have a happy life.
Yeah.
That's great. That's great to hear. So earlier, I got a response from your wife about Bob Story, and as you know, Bob Story, that's what the foundation is named after. A gracious doctor, and I just want to read this, and let's get your response. It's a statement from Bob Story. As far as giving back to our community, it's a state of mind. We can make time for anything. It depends on the priorities. A few hours a week is all it takes, and the payoff is great. Feeling of personal satisfaction when you're helping someone else. Sharing is a good business, whether it's for a coworker or less fortunate. Bob Story. What do you think about that?
Oh, I think it's spot on. Yeah, I think a little philanthropy goes a long way. So, yeah, anytime you can give back,
just a few minutes, even a few minutes a day can make a difference in somebody's life.
Yeah. Yeah, and there's many ways to do that too. It doesn't have to be a huge event like this. It's just, the smallest of things can drastically change somebody's day or life or whatever. So.
Yeah, he got something going that, he passed away in 2008, and his name, legacy still goes on. So yeah, great man in Alberta Health. So. How do you feel about the story? Like, what would you do without it?
I really don't know. It's just for the situation we were in, it just couldn't have turned out any better. Like, we had such an amazing hospital to go to. We put all of our trust into these doctors that were so amazing with every family that's in there. Our surgeon that did the surgery on Hudson's little strawberry-sized heart, Dr. Alaklabi, he would find us in the hallways and just ask how he was doing. And this was well after his surgeries, like during his checkups. And I don't even know how many kids he sees during the day, 2 or 3. So it's amazing to have that kind of respect from the surgeons as well. So
that's nice.
Yeah.
Earlier, I read your statement about the founder, Bob Story, and he basically talked about giving a moment or two of your time every day or every few days, and it adds up.
Yeah.
What do you think about that?
It's true. Like, I think going back to when we were there, we were just trying to think of ways to give back. It just feels, I don't know, we teach our kids to be kind and give back, and that's just something that we believe very strongly in. So as much as we can, we try to give as much as we can.
It's so important. It's so important to be kind and give back to a community that helps you or anybody. It's just so important to be able to have an avenue to give back as we do. So yeah.
Yeah, and then one day, all your fortunes go back, and then you can help other people.
Yeah, exactly.
Yeah.
That's great.
And everybody needs a little help. Sometime you never know when you yourself might need help. So anytime you can give it, it's setting yourself up to receive it if you ever need to. So.
All right, that's great. Well, this is Dave from Red Deer City TV in beautiful sunny Red Deer, Alberta, and I hope everybody comes down and contributes to the event.
Be great to see everybody.
Yes.
That's awesome. Thank you. Bye.